Hi, my name is Jennifer Green, and the topic I'm going to talk about today is home infusion. And this is my audience. I've been a registered nurse for about 22 years. The last 9 years I've been in a business called Home Infusion. People often ask, what hospital do you work in? And when I respond where I work and tell them that I teach people to give IVs to themselves, they look at me and I still know that they don't know what I do. This is going to be an informative speech. I'm going to cover 4 main topics. 1, general terms about infusion. 2, a little bit of a history of why we have home infusion. 3, diseases that we treat at home. 4, administration methods. So the term infusion simply means the administration of medication through a needle or catheter. That typically means an IV that everyone thinks of when they're in the hospital, but it can also mean intramuscular or a shot in your arm, or epidural, which is a catheter that's in your spine to administer medicine. When we do infusion at home, we have a little bit stronger of an IV that can be in your arm for up to a year, and sturdier to use for everybody. So when you add the term home to that, to infusion, it just means it's medication that's administered through a needle or a catheter at home. And it sounds simple, doesn't it? But think of the sickest person that you know that lives way out in the middle of nowhere that needs an IV started. It's just not so simple. So a little bit about home infusion. Up until the 1980s, you had to stay in the hospital to receive any kind of IV. It was very expensive, and it could be up to 6, 8, 10 weeks stay in the hospital. So the emphasis became finding ways to cut costs. So they developed easier methods of infusion. So they started different outpatient settings, such as infusion suites and home infusion. So where I work is a home infusion pharmacy. We treat people at home, and we also provide these medications in our infusion suite. They're specialized drugs that are mixed in a sterile environment by the pharmacy and pharmacists, and RNs teach and administer the medication. We consult dietitians and have a physician oversight. Some diseases that we treat at home, infections that are not responding to oral antibiotics. So there can be cellulitis, osteomyelitis, which is infection in the bone, and sepsis, which is infection in the bloodstream. We also treat cancer patients with chemotherapy, congestive heart failure, Crohn's disease, malnutrition, and pain management, as I talked about with the catheter in the spine. Our most common patient is IV antibiotics. They're usually on for 6 weeks, and we see them weekly to draw labs and take care of that permanent IV that they're not permanent, but that long-term IV in their arm. So the 4th thing I want to cover is the administration method. At home, they can either receive their IVs in something like this, which is called a home pump or an elastomeric pump. The medication's in that ball, and once you hook it up and unclamp it, it administers over a certain amount of time. Sometimes it comes IV push. Everybody's seen a syringe like this. We teach them to push it in over 2 to 5 minutes and how to flush it before and afterwards. Some people have a Curlin pump, which is a pump that's connected to them at all times. The nurse monitors them, pharmacist and physician all monitor in the home. So in summary, I've covered the definition of infusion, a brief history of why we started home infusion, some diseases that we take care of at home, and administration methods to receive this. Home infusion is a safe alternative and very cost effective. Yeah,